Welcome back to Wake Up America. Breaking news now from the Bureau of Labor Statistics. Good news about the economy. Annual inflation cooled to 3.4% in July. That marks the second straight month when annual inflation slowed down. This as prices rose only 1% monthly. Gas, most of the driver there, 2.9% down in July from the previous month, helping to keep a lid on inflation. So we'd love to hear that.
Welcome back in. Our week-long look at the effects of socialism, now shifting to how it affects healthcare.
Yeah, specifically, we're taking a deeper dive into what socialized medicine really looks like. And to help us do so, let's welcome in former Chief of the U.S. Office of Citizenship, Alfonso Aguilar, along with President and CEO of the Pacific Research Institute, Sally Pipes. Good morning to you. Now, Sally, you wrote a very great op-ed about this in the Washington Post about a year ago or so, warning young Americans that they should be careful what they wish for when it comes to socialized medicine. We see healthcare systems in countries like Britain, Canada, enduring huge backlogs of patients waiting for care. So what should we learn from their mistakes?
Well, you need to learn that Medicare for all means that all private insurance will be outlawed and everyone will get their coverage from the government. And as we know, with a program like Medicare, a lot of Medicare patients now can't find doctors because of low reimbursement rates. So Medicare for all will mean that the government will be in charge. We will have long waiting lists. Today in Canada, the average wait from seeing a primary care doctor to getting treatment by a specialist is 28 weeks. And 6.5 million Canadians out of 40 million are trying to get a primary care doctor and can't find one because there's a shortage of doctors. Long waiting lists, high cost, shortage of doctors.
Alfonso, for these people that are voting for this, for these people that are out there on the streets with the signs saying that they want a socialist society, essentially, what do you want to tell them about what the healthcare system could look like?
That's really a fantasy. They love to romanticize. The left loves to romanticize socialized medicine and government-run healthcare. They say it guarantees access to healthcare, and that's not reality. As my colleague was saying, in socialized systems or state-run systems, you have delays for essential medical services. Sometimes you even have denials. They have to ration care. So people don't have access to the medical service that they need. You know, in Canada, often the way it works is if you don't have immediate access to a medical treatment that you need right away, you go to the United States. That's a reality. And then the other thing is that it requires massive public spending that is unsustainable.
Yeah.
So Sally, I mean, they make it sound like it's just so easy. You just take the money you're paying to the insurance company, give it to the government, we'll do it right. But in the public system in Great Britain, what, 48% of the medicines launched worldwide aren't available? I can't imagine if the latest and greatest that's coming out from American pharmaceutical manufacturers isn't available to you.
Well, exactly, and the same is true in Canada because both of those countries and European countries have price controls on their pharmaceuticals, and therefore a lot of the drugs are not available to people in Canada. And you know, I mean, as I say, the long waits, the cost. I mean, we spend about $5.7 trillion on healthcare every year. If you were to add what Bernie Sanders, the Pied Piper of single-payer healthcare, wants, you'd be adding another $3 trillion to the cost of our healthcare system. And the waits would be the same there as they are in the UK and in Canada today.
And another example, in France, it's not just affecting patients, as awful working conditions in the country's government-run hospitals now making it harder to find qualified doctors and nurses there. This is what happens, though, when countries have to ration resources, essentially. And we can see now it wouldn't just affect the patients, the people, it would affect our doctors and nurses. Can you elaborate, Alfonso?
Oh, absolutely.
Well, exactly. I mean, go ahead.
Go ahead.
No, I mean, so there will be a shortage of doctors. The American Association of Medical Colleges has already predicted there will be a shortage of 46,000 doctors by 2036 in this country. And, you know, if we had socialized healthcare, if the government complete takeover of our healthcare system, as Bernie Sanders wants, and now Mr. El-Sayed, who's running for the Michigan Senate seat, this is going to be a huge disaster.
All right. Thank you both, Sally, Alfonso, for your expertise this morning. Thank you for joining us.
All right, you're watching Wake Up America.